Hi, good morning, Dean. My name is Rena Pakin. I'm your invigilator for the OET speaking session conducting on the 12th of February 2021. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you say your full name for the record, please?
My full name is Dean Smith.
And what is your candidate number, please?
My candidate number is 251372108.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What do you contribute to your patients as a nurse?
With my care, I will make my patients know that I am there to provide comfort and understanding, that I will listen to their concerns, and also, I will act as their advocate if necessary.
How do you respond when family members ask for your personal diagnosis?
Unless it's my role to diagnose, I wouldn't do so. But, I would try to dig in a bit and figure out why the patient's family member was inquiring. Does the person need some validation? Did the doctor not explain the prognosis clearly? I'd seek to be helpful and share important information, without stepping outside of my role.
Talk about a time when you were completely overwhelmed by your workload. How did you handle that situation?
With the substantial coursework that comes along with a nursing degree, I found myself overwhelmed with my workload frequently in college. I found it best to create a schedule for myself, to try to manage all the work I had to complete. What's most important, though, when it comes to an overwhelming workload, is to never sacrifice accuracy or quality in the work. As a potential nurse, I know how important that is. No matter how much work is expected of a nurse, a simple mistake while rushing could have disastrous consequences.
Describe a time when you were the leader of a group. How did you make sure your direction was clearly understood?
I'll go back to the end-of-year project. There was no technical group leader, but I definitely spearheaded our project. I found that timely and succinct communication was most helpful. I think that will translate well into a nursing environment. Timely and succinct communication usually results in effective communication, which is extremely necessary for the field of nursing.
Talk about a time when you were under significant pressure to perform a task. How did you get the job done?
This question immediately brings my first clinical to mind. I was tasked with giving an IV to a patient. I had built up a ton of pressure on myself to succeed. After how hard I hit the books, I figured I should be able to give an IV with no trouble at all. Unfortunately, I was having some trouble. The pressure started to get to me, but before the patient could notice my discomfort, I took a deep breath, went over the correct technique in my head, and inserted the IV.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you.
Excuse me.
Yes.
Can I have the name of the patient, please?
You can call her Rainy Beth.
Thank you.
Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Hi, I'm Dean Smith, one of the nurses in the emergency department. I'll be the nurse looking after you. How are you feeling now?
I'm all right, nurse. I feel a small headache. How long I have been here?
Not so long, Rainy. May I know, is there anything I can do for you?
Nurse, am I badly injured?
No, Rainy, you just relax. You suffer mild injury to your neck, and everything seems to be fine.
I feel like it has been ages since I'm here. I have no signs of broken bones, cuts, or bruises.
Calm down, Rainy. Just relax. Please listen to me. Could you please answer a few of my questions first?
Yes, I will.
Do you know the reason why you are being kept here in the hospital, Rainy?
I will be undergoing some medical diagnosis following the road accident I had today.
Yes, you are right. You are here in our observation and expected to be discharged later in the day.
If I am fine, why am I on medication?
Rainy, in the accident you have a minor injury called whiplash. Whiplash is an injury to the cervical spine. And as you told me earlier, you have a headache too. So you need to be on the medication until you are fully recovered.
What kind of medications? Could you please explain it to me, nurse?
Whiplash is a neck injury due to forceful, rapid back and forth movement of the neck, like the cracking of a whip. It may last for a couple of days to a few weeks. Treatment typically begins with over-the-counter pain relievers, applying ice, and also using a collar to support the neck, etc. If the pain persists, treatment can include physiotherapy and prescription medication. In rare cases, injections into the neck may help.
Thank you for your words. It was very informative. Nurse, I have to get better in the shortest time possible. Is it possible to get a faster recovery by enrolling in a physiotherapy session?
I really understand your situation. However, immediate physiotherapy is not possible. The best option is to take a rest for a few days and use ice or painkillers if necessary. When you get rid of the pain, you can start physiotherapy.
Oh, I see. Nurse, how long do I need to take the treatment before getting better?
I acknowledge your anxiety. Nevertheless, I cannot assure you a definite time for curing the pain. It wholly depends on how you care and follow medical advice.
It's all right. Is there anything else I need to know?
Rainy, the important thing you should keep in mind is that recovery in this type of case depends on how sincere you are complying with the treatment and exercise program. In your case, the whiplash is minor and can be cured easily. But, If you didn't take proper medication, the minor injury can become a severe injury. I hope you understand the seriousness.
Yes, I do. It was a good explanation.
Thank you for your words. May I know, is there anything I need to clarify?
Nurse, is there could be after effects or ongoing problems as a result of this accident?
As of now, there seems to have no issues. However, it will be great if you could pay attention to any of the following issues. Also, it is important to seek medical advice if there is any increased pain or discomfort, nausea, vomiting, or vision problems.
All right, nurse. Thank you.
If you need any help, please push the button on the left-hand side of your bed. I wish you a speedy recovery.
Thank you, nurse. That is the end of your OIT speaking roleplay. All the very best.
Thank you.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.